Wonderful. Okay, we'll get started. Welcome everybody to the COVID-19 communityresources.com town hall meeting powered by the Center for Closing the Health Gap. I'm your moderator. I'm Cincinnati City Council member Jan-Michele Kearney, and you know our topic, back to school. Are we ready? How are we going to handle it? What are we going to do? What's the best decision? Lots and lots of questions, but we have a stellar panel of experts to answer our questions and talk to us about this topic, because I know there's just a lot of anxiety out there. Our panelists today are going to be CPS Superintendent Laura Mitchell, and she's on her way. We have a CPS Principal, Stacey Hill-Simmons. We also have a CPS parent, Valda Freeman-Karmo. And we have just the best pediatrician ever, Dr. Bradley Jackson. Before our panelists give their intro remarks, let me just do a few quick housekeeping items. You know, we always have to thank our tech team for making this happen. So thank you, John Reichel and Lauren Harden. They're going to make sure that if you're watching on Facebook Live and you put your questions in the chat, we will get them and we will ask them. And then of course, if you're watching on Zoom, you can go ahead even now and enter your questions into the Q&A. And we're going to get to as many of your questions and comments as possible. You're free to do it anonymously. We love to hear your names and actually know who's asking, but it's totally up to you. And if there's a certain panelist that you want to answer your question, make sure you mention that with your question. Also, just so you know, we are recording this session because we always play them back on COVID-19 communityresources.com as well as other platforms. Okay, so I see our CPS Superintendent Laura Mitchell has joined us as well. Thank you so much. So let's get straight to our back to school topic. I would like for each of the panelists, and we'll start with Superintendent Mitchell, please just give us a few intro remarks, and then after everyone's made their remarks, we're going to go straight to questions because we already have quite a few that have come in early. Okay, welcome everybody. Superintendent Mitchell.
Yes, thank you. I apologize. I've been in spinning mode for like the last 25 minutes, waiting for the host to let me in. So my apologies for being late.
Yeah, we've had all kinds of tech issues this morning or this afternoon. So it's definitely not your fault. We're just glad you're here.
Good, thank you. So many of the members who are listening to this or the public may know that the board made a decision on August 3rd to start in distance learning. And that decision was made based upon 4 data points. And so we work with the health department as well as Children's Hospital in terms of working with their physicians to help guide us through decisions that are related to health and looking at the science. And so the 4 data points that we looked at, the first thing we looked at is the positivity rate for the city of Cincinnati. So that pertains to of the people who are tested, what percentage of those people actually have COVID-19 are confirmed. And so when we looked at this data several weeks ago, we were at 7.7, and we wanted to really be around 5 to 6%. The second data point that we looked at is the health advisory that came from the governor's office, the color coding levels 1 through 4. And at the time we were in level red, which is level 3. And we were closely approaching level 4, which is purple, which means everyone stays home. So that's the second data point that we looked at. We also looked at the epidemiology curve. And so on a daily basis, I get a report from the health department that will tell you the number of confirmed cases each day from March until the present date. And so we look to see from the date that we're on, backtracking 14 days, and we count back to say, if we look at that date comparison to today, are we actually trending down? And so what we saw on August the 3rd was a very unstable system. So one day we were high, 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 and then down, 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 and then spike again. And so we want to see consistent days in terms of consecutive days that the data is actually showing that we're moving down. And so those were the major data points that we looked at to decide whether or not we were actually going to open. The fourth data point is the number of days that it takes to actually get a test result. And so we've seen it range any way from 3 days to 14 days. And so we felt that that was too big of a range, and people could actually be walking around after having had the test, waiting for the results and be confirmed positive. And so based upon those data points, we made a decision to start with distance learning. Now, many other districts in the state of Ohio, large urban districts, they're saying they're going to do that for the entire first quarter. And we said, no, let's look at the first 5 weeks, because we know how important it is for our kids to be with their teachers and to be with their friends and their peers. And so we didn't really want to give up an entire quarter. And so we said, we'll look at the first 5 weeks. By September 14th, we will make a decision as to whether or not we can move to face-to-face 2 to 3 days a week, which means that only half of the kids are there on any given day, which still allows for social distancing. The other reason that we really did not want to throw away the entire quarter is the fact that the medical scientists and professionals are saying that the months of November through January are going to be extremely tough months. And there is likely that we won't be able to be in face-to-face session because of flu season. And so what I want to be able to do is front load as much as I can in terms of instruction and practices around distance learning with the kids and the teachers, so that if we have to be out for an extended period of time, everyone knows exactly what to do and our kids won't lose so much ground. And so that's where we are as a district as of today.
Okay, thank you so much for that intro. That's great. Okay, let's go to a principal, Stacey Hill-Simmons. Thank you. So is Stacey on?
She's muted.
I'm sorry. Hello, everybody. I'm Stacey Hill-Simmons. I'm the principal at Evanston Academy, proudly servicing the neighborhood of Evanston. I've been with Cincinnati Public about 26 years, and I'm happy to be here today. Thanks for having me.
Thanks for being here. We appreciate it. So we'll have lots of questions about your students and parents, but let's hear from a parent now, Valda Freeman-Karmo.
Hi, I'm Valda Freeman-Karmo, and I'm a parent, and I have 3 children in Cincinnati Public Schools, all the way from a senior at Walnut Hills to a rising freshman at Schroeder and a rising sophomore at Woodward. And my 2 younger ones both have special needs, and they're both in either an autism class or a multiple disability class. So I've got the whole spectrum of needs, and I used to be pretty apprehensive and fearful. I'm really blessed to have really engaged teachers and principals, and even the district. I kind of was feeling until really yesterday, like, oh my God, how am I going to pull this off? I nearly died trying in the spring, trying to help with homework and school. But now I feel like, this is a true partnership. And a friend of mine, we have a Down syndrome group of African-American parents, and one of the sisters is a speech therapist. And one of the things she said is, you got to give yourself grace. And it suddenly occurred to me, I need to extend that grace to the teachers, to the staff, to administration. We're going to do this together, and we're going to do the best job we can, and that's it. We're going to do the best job we can, and that's it.
And we're all going to be patient with each other. I love that. Give each other grace and give yourself grace for sure. Thank you. That's very good advice. Okay, Dr. Bradley Jackson, and we should say you're representing the Cincinnati Medical Association, and you're one of the past presidents of the Cincinnati Medical Association.
Yes, Jan-Michele, thank you so much for inviting me along with Renee. And when I was asked to speak, it was sort of a no-brainer to be involved. Now, I've been actively practicing at least for the last 3 years, but I've had 27 years of experience in terms of just how healthcare has been managed here in the state and certainly nationally. Being involved with the National Medical Association, which is the larger branch of the Cincinnati Medical Association. But in my current role, I'm a medical director with Anthem, and I've been in the dubious position of seeing how we're managing our members throughout the entire country. And I work specifically for a plan in Maryland, even though I'm based here in Cincinnati. And it's really amazing how each day, the way we manage our members in terms of utilization is far-reaching. I've been very impressed just with Laura just presenting the approach that CPS is taking, and it's very admirable and very comparable to what we're seeing nationally. And every school district community, whether it's CPS, it could be different in Fairfield, and a variety of different places throughout the country have a different approach. And one of the things I've understood in just researching the school approach is how important the school system is to the community and to how far-reaching it is even to the household. And so it takes a very, very strong approach and having the right people involved. And when Laura mentioned about the importance of having the health department, Children's Hospital, which is one of the top institutions in the country, if not world, to have those important people to help advise, we are actually establishing a really strong foundation here. We can't really control the virus. We can only control how it's transmitted. And so you have to have a very strong approach, but also learn and understand the individuals, the students, the staff that we're involved with. And one area that was already mentioned by Valda is understanding the needs of all of our students, those who have special needs, and they have to have a certain setting in order to really augment their learning. And unfortunately, the home may not be that place. And also having to take into account the parents involved. So it's a very important steps that need to be taken to involve the entire community in the approach in terms of returning to school.
Okay, thank you so much. Let me start with, and thank you all of you. Let me just start with one of the questions that came in, and this is from, I think the name is Wallace B. And Wallace B says, I understand your district has a forum, a hotline to care and collaborate with employers about their safety and well-being. And he said, what does that look like? The self-care, please explain. So this is probably for Superintendent Mitchell.
Okay, yes, thank you. So we started when we opened with our teachers coming back to work last week. We have a hotline, an employee hotline. And so it is a hotline that we can collect very specific questions related to health concerns from individual teachers or staff, any staff member, as well as safety concerns. And so when you enter any of our buildings, we spent all summer cleaning our buildings, putting the proper signage up, stickers, floors on the stickers, thermometers to do the health checks when you come in, masks. And so in addition to little cleaning kits in every single classroom. And so what we are telling our employees is that if you see a violation of any of the safety precautions that we have said are part of our protocol, then you call into this number and you can identify the school or the office and let us know exactly what it is, and we'll have someone from our facilities department take care of it as quickly as possible. So we're doing this in an attempt to really help employees feel more comfortable with being within our buildings. The big message is that we are in distance learning, but our schools are open. And so I think that someone mentioned this, Dr. Jackson mentioned how important our schools are. Our schools not only deliver instruction, but we have 24 school-based health centers. They look like any doctor's office. We have eye clinics, we have dental clinics, we have mental health services, and we also obviously give out food. And so during this closure time, when our buildings are closed to our kids, we will be giving out food to at every single one of our schools every Wednesday from 12 o'clock until 4 o'clock. And we will give multiple meals, which will last the student for an entire week until the next Wednesday. And so Dr. Jackson is right. The community really depends on our schools for a lot of different things beyond teaching and learning. But we have to make sure that our employees feel safe so that when our kids do come back, that they can help make our kids feel safe. Our Assistant Superintendent, Susan Bunty, has also been offering professional development for teachers around self-care, social and emotional care for themselves. We have a crisis team in place and a crisis protocol to be able to take care of anyone who has major concerns or is experiencing sickness themselves, or a family member or a staff member. So there's always more that we could do to support the care of our employees, but we do have a hotline for our employees to be able to call in. When school begins, we will also have a hotline for parents, and that hotline will be manned. We have an entire staff who will be manning the hotline that can answer parent questions regarding instructional things, technology use. And so we're using Hotline to be able to address not only our students and our parents, but also our employees.
Okay, thank you so much. And we're going to talk in a minute a little bit about what it's going to be like when the schools actually open up to in-person learning, assuming that decision is made September 14th. I think that would start September 28th, you said. But let's go back to where we are now with online. So I wanted to ask Valda, I know in March when COVID hit, we were all just blindsided. So suddenly parents became teachers, and you're talking about 3 children, and you're talking about special needs and all that. What's different now? What's different now for you?
Well, for me, it's a lot more organized. I probably get about 20 emails a day from different teachers at out 3 different schools from the district. So I'm trying to just, calm down and breathe, put all these in a folder and have a process where I can just keep track of who asked me what or who said what. So it's a lot more push versus pull. And I'm looking forward to the partnership. The partnership is really different. The teachers seem to be more engaged, because I think part of the issue, most of the teachers for my children, they also had children. So it was kind of like a chaotic, let's just do the best we can kind of activity. I'm self-employed. So one of the downsides is I also lost some of my work, so that freed me up more. Well, I've been able to get the work back. So having a system where I can make sure all my children are in the right Zoom class, like all of these organizing things are things that I'm working on now. And the teachers, I'm actually having 2 IEP meetings to update their individual education plans so we can make sure. And I've already told them, like, look, I'm working, I can't be on every Zoom call. How are we going to do this?
Okay, that's good. Yeah. So it sounds like you're organizing all the information. I know there's info overload, for all of us, because we're getting COVID information, school information, all this is going on, but you're saying you're also realizing you can't be in every meeting. So you have to pick and choose. And so the communication seems better. Well, because I know in March, we didn't know no one really knew what was going on. I felt bad for Superintendent Mitchell and Stacey Hill-Simmons. I don't know how you all even handled that, because that was just, everybody was blindsided by this COVID-19. Stacey, what about you? How are things going? You have to unmute.
It's going well. It's going well. It's definitely a new experience. I feel fortunate to be able to serve my community, but I'm also in a situation where my staff is outstanding. So I'm working with some of the best professionals in the game. So it makes it a lot more doable. To be clear, when March hit, we had to pivot to distance learning. But what we did at Evanston was we coined the term, we branded the experience, and we called it Evanston's in Session. So what we're doing now is just relaunching that, running faster, doing a better job with that, because the district has padded the experience with a lot more preparation. But I feel like all of our school leaders, is definitely stretching you in a different space. For Evanston, it's a more senior staff, and we're pretty seasoned and consistent about how we do our work. We've done really well and have been able to amass a history of success. But when you lead winners, they are not interested in changing. The Lakers don't change how they play their game because they're winning. So my Lakers don't want to change how they play their game. So we've had to make some changes. It's August right now. We've already had our first fight. We don't usually have our first in-house fight until around October, but it's been challenging. We've had to, as the leader, I've had to listen a lot more, but pivot and walk away from some tried and true practices to embrace this new experience. So for me, I'm taking the challenge as looking at growing some skills that may not have been as strong for me, that I really didn't have to use. We've been in a situation at Evanston where all we really have to do every year is look at the charge, reassess our skills, tighten up the things where we weren't as strong, and go at it. This year is totally different. We've had to acquire new skills, abandon some old skills. So it's definitely a challenge, but I'm proud of our district. I'm proud of our school. I feel like we're ready and we're here and we're gonna do our best, but I'm definitely hearing what Valda said. I'm trying to give myself that grace.
Yes.
Give my staff that very same grace, and we're gonna ask the parents for that as well.
Right, there you go. Superintendent Mitchell, I know one thing you said when you had the town hall with CPS, and it was really wonderful to see because, you know, one thing you said was, yeah, this caught us by surprise in March, but we're ready now. And I know over the summer, you all have given students, I mean, you've given away thousands and thousands of computers and, you know, made sure everybody's got internet. Tell us about that whole process, because that was a big thing. We weren't all connected back in March.
Yes. So first of all, I'm happy to hear Valda say that she sees a difference this year in comparison to last spring. So I'm happy to hear that. And Valda, I do want to hear what's not working offline. Sometimes we want to make it better for parents. And I know that people have felt bad for CPS. I have felt bad for the parents, trying to juggle all of this, trying to work, trying to make sure their kids are learning. It is really hard as a parent to do all of these things. And so what we're trying to do is we're trying to remove barriers and make it a lot more easy for our parents. So one of the first things we did in March is we put two teams together, one team to focus just on the safety aspects of coming back, and then another team to focus on the learning aspect. And so one of the things we did this summer is that we offered workbooks that covered every subject to give out to all of our schools, where you could go up to your school and pick up a workbook to be able to help push off some of that summer slide. And so that was the first thing that we did, and parents could get those to be able to work with their kids. The other thing is that we purchased and secured laptop computers for all of our students 2nd through 12th grade. And so I can tell you today, we use data a lot to inform our decisions. So I can tell you today, I get a report every single day that 60% of the laptops have been picked up. So over 21,000 out of the 36 have been picked up. And we know that we still are getting communication out to parents to say, okay, come in and get your laptop. Pre-K through 1st grade will have iPads. And so all of our kids pre-K through 12. And so again, we're getting the message out to parents, please come up to your school and get your laptop computer. With a partnership with Cincinnati Bell and the Greater Cincinnati Foundation, we were able to work out free Wi-Fi for our young people. So this pandemic has really had the opportunity to shine the light on disparities within our communities. So there are a lot of kids who had laptops. There are a lot of kids who didn't. There are a lot of kids who had Wi-Fi. About 11,000 households did not. And so we felt that it was important for us to provide free Wi-Fi. So Cincinnati Bell came to us and said, we'll work on a partnership with you that will offer Wi-Fi for 12 months at $207 a month, a year for 12 months. And so our district came back and said to donors, look, we need to make it completely free. And so people have really come to the table. Children's Hospital, Hale Foundation, GE, Greater Cincinnati Foundation, a lot of other people are pitching money in to be able to make the Wi-Fi free. And so I do have a number. If there are any parents out there who still need the free Wi-Fi, here's a number you can call.
Okay, let's know.
566-3895. And that's for any Cincinnati Public Schools child can get free Wi-Fi. If you are a Spanish-speaking family, the number is 566-3894. And so we are working on right now a continuous improvement project to get as much Wi-Fi out into the hands of our kids. And so this is the area we still need to do a lot of work. We have about 1,600 people who have taken us up on the Wi-Fi, but we know that there are 11,000 households. So on a daily basis, we're trying to get the word out about this. Just another really quick thought for parents and for people to know, we are going to have a district-wide orientation for families. And so we had to think about, what if you're a family and you don't have Wi-Fi? How can you have access? And so we are going to broadcast this on Channel 12 on August the 30th at 11:30 a.m. So any family, any partner can tune in to Channel 12 on August the 30th at 11:30 and have an overall orientation that will tell the parents all about the Wi-Fi program and the computers and how to use them. We will have that recorded, so you can go to our website and get the information if you're not able to make that session. There will be 150 commercials airing between now and August 30th, broadcasting this special, because we want to get it out there for everyone to know.
That is fantastic. I just, I want to stand up and cheer. The fact that all of our students are getting computers and internet, I mean, that's just huge. And then when you talk about, first of all, as Dr. Jackson said, we don't know what's going to happen with this virus. I mean, we can't control that. And you said maybe in November, things, might get a little dicey again, but we are prepared. If our students have internet and have computers, it's not going to be like it was back in March when people were scrambling. So that, I mean, this is fantastic. I'm really excited. So, hats off to, Cincinnati Bell and Children's and Greater Cincinnati Foundation and Hale Foundation and definitely CPS. I mean, this is really huge. There's so many cities that don't have those resources. So I really applaud you all for that. And so another question that's come up is, what can the community do to support CPS communication and the students and families? Like, do you all need tutors? I mean, a lot of different groups are saying, we've got a group, like Links, for example, or Delta Sigma Theta, Alpha, Kappa Alpha, all these different organizations. Should we, get our members to volunteer? So tell us, what can the community do?
Yeah, so I'll start off, but then I'll ask Stacey to join in, please. So the number one thing in my mind that the community could do is to get information out to parents to say, if you have a child in CPS, make sure you contact the district and ensure that the district has your current up-to-date contact information. So that's 363-0123. If you've changed anything, phone number, email address, home address, we need that information so we can communicate with you. So that's our number one thing. The number two thing, and actually it's probably, it's a running a race for number one, is this. We really need the community to promote social distancing, to wear a mask, to stay home when they're sick, so that the positivity rate can continue to go down and the curve can continue to trend down so that we can get our kids back in school. That's what the community can really do and help us out with. So, but Stacey, please join in.
Let me jump in on that. That is such a tough sell, and I don't get it. I don't get how people are out there not wearing masks. So, every day someone tells me, oh, I was at this store, this park or that park, and all these people were there and they weren't wearing masks. I guess because they feel like, the ordinance is in place, but they feel like, oh, we aren't going to get penalized. Nobody's going to catch us. It is just, to me, seems like the most selfish thing. It's an easy ask. Put the doggone mask on, for heaven's sakes, people. Folks are getting sick. Our kids aren't in school. It's a simple thing to ask. It's for a short period of time. And other than just running around like screaming at the top of our lungs, I'm just thinking, what can we do to get people to wear a mask? It's just such a simple ask. It's not a huge sacrifice. But yeah, we have to just change our whole way of thinking about that. Ooh, okay, that's my soapbox. Okay, Stacey, go ahead. I'm so frustrated with that. Like, oh my goodness.
Hey, Jan-Michele, can I chime in on that? Certainly as a health, professional, the first thing I want to establish here that's been really communicated in this conversation is how I'm viewing our teaching staff and administrators. You are front line as of the start of now and certainly with school. And I think we need to value our teaching system to say now they're front line. We're bringing people, at least a portion of individuals back into the school system with the option of certainly virtual learning. But the one thing that has been just emphasized, Jan, is the importance of really preventive behaviors. And this is not just in school, but certainly at home. And part of that is really being able to make sure we engage and encourage. Some, just because they believe that children don't transmit it as much as certainly the adults, that's the one thing we don't want to fall prey to in believing that. But I think the importance is continue to communicate. And in that communication, as Superintendent Mitchell had mentioned, is that please keep your communication channels open. Phone cell numbers change. All these things change on a regular basis. Update them so that they can communicate. If there is a positive test that occurs in the school, they want to be outreaching, contact tracing. All this requires effective communication. And if we don't have that, that means someone's at risk of getting exposed. I want to mention one other thing. Certainly in the school setting, and I'm sure this is a part of the strategic plan in the schools, is about cohorting. Cleaning surfaces, getting people into the right place in the school system, because there are some children are lurking around, unbeknownst to them, that they may be carrying it. And so the school system has to have a very strong strategy about what happens when we find a child that's symptomatic, fever, cough, shortness of breath. They have to be able, that's how complex this is, to be able to put them in the right place and reassuring the parents that we are in a safe place as they've always been. We just want to reassure you that, and the only way they can do that is communicating effectively.
So thank you, Dr. Jackson. We're going to make sure on COVID-19 communityresources.com that we have all three numbers listed. The two numbers, English speaking and Spanish speaking, for getting computers or getting free Wi-Fi, and then that 363-0123 number. If anything has changed in your household, address, phone number, we want people to call call CPS. 513-363-0123.
But Jan-Michele, also as it relates to the civic organizations, Jack and Jill, Delta, AKA, even Kappa's Q's, it is imperative that you guys continue to get out there and spread the word that all the great things that CPS is doing, and assuring your neighbors, your friends, your family that we are here to serve. We're still in the business of serving families. So we don't want families to disconnect and unplug from us during these difficult times. So it is critical. I know that when Jack and Jill starts back up, I'm going to be asking the I'm going to ask the moms to continue to push CPS as a viable option, because our goal is to make sure that we're servicing every family and meeting the needs of every family. Now, looking at it from a different street, Evanston Academy is a school that has built their whole experience on partnerships. GE, Western Southern Financial, Xavier. That's an entirely different talk show, because right now we are only allowing in the building essential staff, right, critical personnel. So for us, for the last 11 years, we've had a tutoring program with GE, 11 years. This would be our 12th year. We've had to pivot and rethink what that will look like, because it's a very important partnership for our district and the kids that we serve. So we're looking at and meeting with GE, I think it's Thursday, to look at how we can do what we've been doing remotely and looking at what that experience will afford for the kids. So there are always other options. So one thing I would encourage our listeners to do is not give up that partnership because it can't be face-to-face anymore, but think outside of the box and look at how you can still provide services for the kids that we provide services for.
Right, I love that. It might be zooming in with your 2T and going over math problems with them, virtually. There's still lots of things we can do. Let me just say this, because Stacey, you were mentioning what a great job CPS is doing, and so here's a testimony from Tamika Chambers. It might be Tamika. So Ms. Chambers, if I'm not getting your name right, I apologize. But she says, hello, my name is Tamika Chambers. I'm a teacher and a parent with CPS. I am so thankful for the tutoring option that you have given staff. I did not know what to do about childcare. I know she will be in a structured environment while I focus on virtual learning. And then she says, thank you. So she is a very grateful CPS teacher and CPS parent. So that is good news. That is fantastic.
And I want to say a thank you too. One of the things that happened is Two of my children with special needs, they both qualified for extended school year, which is a more structured summer experience, summer camp. And we were like touch and go. We didn't know until like 2 days before, like, yes, the governor said you can do it. And it worked out fine. I was scared to death because of, back in June, we really didn't know if it was safe to be around anybody. They hadn't gone out of the house basically except for take a walk. But there was no incidents at all. And it just proved to me, and these are children, like one of my children, he's super sensitive to anything touching his face, even like a washcloth, like it's like a wrestling match every day just to wash his face. And so the mask option was like not an option at all. And I'm sure there were other children who have autism, that sort of thing, that they can't wear masks. And, the particular program is actually staffed by CPS paraprofessionals because it really is extended school year. It's not just playtime. And they cared for my children and took those risks when no one knew like really what the risks were and how it's going to turn out. And it just worked. And so I'm very grateful for the dedication of the staff of CPS. And I just wanted to say that publicly.
That's fantastic. CPS is doing a great job. And let me ask you, when school, and I mentioned this a little while ago, but when school does open up, let's just assume that, those 4 data points that Superintendent Mitchell mentioned, all say, okay, time to open up. And you're going to know that around September 14th. So 2 weeks later, school opens. What's going to happen? Do students get tested as they walk in? And then what happens with the buses too? I've had a few people who are bus assistants, and they were saying, what about the students getting on the bus? Do they get tested before they get on the bus? Like, how's all that going to work?
Yeah. So right now, today, we do not have a broad system for all of our students. All of our employees, though, are required to be tested and show documentation that they've actually had a test. We are working now, there's a county grant to provide testing for adults. And so we're looking right now to see if we can do like ongoing regular testing for all of our adults entering our buildings. For our buses, when kids enter the bus, they will have to have a mask on. If they don't have a mask, then we will provide a mask for them. So we have thousands and thousands of masks that we've already ordered for the adults and for the kids. There will be bus monitors on the buses to be able to maintain social distancing. We will allow students who are from the same household to sit on the same seat, but otherwise we will social distance the young people. Once they come to school, if they are a bus rider, when they enter, we have several different entrances. So we have a district-wide pandemic plan, safety plan, that was reviewed and approved by the health department. And then each school used that template to build their individual customized plan. So schools have multiple entrances so that we can limit the number of people who are coming through any entrance. When you come through an entrance though, you have to have a temperature check. If you don't have a mask will be given to you. And then there's a hand sanitizing station you have to go to. And then when you go to your classrooms, we are going to have the young people stay together and have the teachers rotate. So our healthcare professionals have said, don't have the kids mix, keep them in cohorts. And so they will stay together either in a cohort at the elementary level, and the teachers will rotate. Every time a child leaves a classroom, we have to know exactly where they've gone, who they came in contact with. And when they come back, they have to hand sanitize as they enter into the room. We will have meals inside our classrooms so that we aren't gathering kids together in large spaces. And we have kiosks that have been developed to be able to deliver the meals to the classrooms. And so that's what we have at this point. We also do, for the upcoming school year, we will have a registered nurse in every single one of our schools, and that will be the safety officer for your school. And that will be the person who will isolate children. So every school already has to have an isolation room. In many cases, so we were planning all of this, but the proof is in the pudding. And so I had to see for myself. So on August the 3rd, I said, no, I need to walk some schools and I want to see all the procedures. And so a team of us, Children's Hospital, the health department, CPS, we walked 4 of our buildings, 2 elementary, 2 high school, to look at all of the procedures in place and then to make recommendations as to what needs to happen over these next 5 weeks to ensure every single school is up to speed. And so that's the work that we've been doing, but every school will have a nurse. That nurse will be the safety officer and will be the person who will keep track of suspected cases. And we have a flow chart in terms of what happens if there's a suspected case. There's a notification, there's a cleaning. What happens when there's an actual confirmed case? There's the isolation, the notification, and then we see if there's been any distance or any exposure. And according to the CDC guidelines, we're going by the 31 guidelines provided by the CDC. And exposure means that you were within less than 6 feet with someone who has COVID for 15 minutes or more.
Okay.
And so our nurses will be collecting that information for any confirmed cases. And then on a school by school or classroom by classroom basis, we will shut down classrooms or schools based upon the severity of the situation. So we are trying to really put precautionary measures in place to make sure that everyone is safe. In addition to the walkthrough, so every school had to have a walkthrough by our facilities team to ensure those processes are in place. We are also implementing daily safety huddles. And so the principals, and Stacey, if you could talk about that, they call in with Sarah Trimble Oliver, our person who's the chief operations, and to say, go through, you know, the 10 things that we say have to be in place. What are those things in place within your school? The other thing that I'll mention really quickly is that what we're going to launch this coming week is a phone app for teachers to report. So we identified 7 things. When you walk in the door and you get to your classroom, was there a temperature check? Is everyone wearing a mask? Is my classroom clean? Was my garbage check taken out? Were my school supplies and my clean supplies there? And then that'll go into a document, into a dashboard. We'll be able to see on a daily basis, classroom by classroom. So we're really taking the safety very seriously. And I'll say that, you know, I think that we've done a decent job, but we could do better. And so we're always striving to make it a safer environment for everyone. So we don't pat ourselves on the back and say we've arrived in any way, shape, or form.
Well, you know, I'm happy to pat you on the back because I think CPS has done a phenomenal job. I mean, we have almost 40,000 students. You know, that is just, you know, those are a lot of people. And, you know, the preparation that you have in place is so reassuring. And I can tell you, when you all made the announcement that you were going to wait to open schools, I felt really confident that that's a great decision. I mean, you went through those data points, you went through what's in place, how this is all going to happen. I think parents, you know, Valda, you can tell me, you know, I thought parents should feel really good about that.
Yeah, I was actually kind of wondering, just, you know, part of my problem is watching too much news, and I've solved that. I can only watch news.
That's all of us, yeah. You can't help it. So
that was making me fearful and crazy. So, but I was like, what in the world? How are they even going to go at all? But then I had that summer extended school year experience. I'm like, oh, you can do this safely. And I felt good that we're using data to make a decision versus some kind of weird, you know, I don't know what you want to call it, political, you know, my right, my whatever.
Yeah, call it what it is. That's right.
I'm an engineer. I want to use data, period. Yeah, right. I appreciate that.
Let's look at the facts. That's right. Let's look at the facts. Yeah, I love that. CPS has gathered the information. And so, you know, Superintendent Mitchell, the way you lay that out, it's very reassuring to say, you know, these are the data points. This is why we're making that decision. And this is what we're going to look at going forward. Dr. Jackson, and I don't know if the Cincinnati Medical Association, and I don't think you guys did, but, you know, did CMA make a statement about whether schools should open or not, or is there a general feeling about that?
As of this date, I don't think we have a particular policy or, say, a statement from the Cincinnati Medical Association. I think what we're doing is still gathering thoughts, endpoints from a lot of different organizations. We do follow in line with the National Medical Association with regards to some of the policy statements, and we're certainly reflecting back on that leadership. From a local standpoint, we're certainly taking into account a variety of different community settings, and certainly the school is one of those. I think what we want to do is continue to be educated about all the different settings in places, whether the workplace for physicians, hospitals, and gathering that before we either get to a point of having to have an established statement. I think what we need to do is continue to encourage those places that are in line in following the guidelines. And I want to first commend Superintendent Mitchell on such a fabulous job that you've done to date. I think one of the challenges you're going to have is certainly, communicating, educating, and reinforcing a lot of the preventative behavior techniques and things that are certainly been ascribed by the CDC. And having reviewed a lot of the statements, that's a very, I can't imagine that website without giving some guidelines, but understanding that from a federal standpoint, they're not even following the CDC guidelines. They've done such a marvelous job in providing those data points and managing, because you have to have some commonality in how you're approaching it. And it sounds like CPS is doing a fabulous job. If I had a child who was at this age and coming into that setting, I would be very comfortable putting my child in that school setting. With all the different factors that are involved. One of the things I want to mention that's really been, I don't want to call it a catchphrase, but understanding social determinants of health. We need to look at all the factors that are involved in the people that we serve. And I'm saying how CPS is serving a variety of different students from different backgrounds. And one of the things that I felt was so important, and when we look back at our experience during the summer, there's usually not much education going on. And we're knowing that these students are missing out. Can you imagine this going on with the absence of school, brick and mortar in the fall? So you have to have a very strong strategic plan to really reassure parents that when they come into that brick and mortar, that they're going to be safe. And also that the learning process will continue even in a virtual format. But understand, this is a new normal. And I say that from the fact that the way we're approaching things now, and I think that's how God works. He says, I'm going to give you a different way to approach things. And this is where the strength of an organization is so important. With the support of the city council, supporting CPS, and all these things, in fact, we're doing things that we've never been approached for in the past. And it's going to be important how we protect our children. And I think once we do that, we will come out with a much better outcome.
Absolutely. Okay, there are a few questions and comments. Let's see. Levon Seiler is asking, when will there be a testing regimen for students in place? And maybe Levon is looking at the 24 health clinics in the schools. I'm not sure, but that's the question. When will there be a testing regimen for students in place?
Yeah, so we are working on that. Right now, we have 33 nurses who will be in our buildings doing vaccinations or vaccines. And so if we think about last winter and spring when a lot of kids get their vaccinations, the doctor offices weren't accepting. And so now our health clinics are open to make sure that we can give those. Children's Hospital, they have a test that we're exploring with them. We're looking at, though, the accuracy rate of that assessment, and it's a really pretty quick turnaround, and Dr. Jackson could probably speak to that more eloquently than I could, but it's something that we're looking at. We do have to also keep in mind, though, that there are many parents who won't want their kid tested and who won't want their kids to have the vaccine when it is available. And we just always have to keep in mind that these are, parental choices, and we have to have alternatives for those parents who choose not to follow through with the test, but at the same time, keep our community at large healthy. And so at this point, the board does not have a policy regarding testing for our young people. They do have a board policy regarding wearing face masks on our buildings or in our buildings.
Okay, thank you. And then here's something from Angela Faye Lachey Terry. And she said, please explain again what the district-wide orientation will cover. And then she says, thank you so much. And that's the orientation. Was it August 30th? Okay.
Yes.
Okay.
Yes.
Tell us about that, Dan, please.
There will be 2 orientations. So there will be a district-wide orientation. Parents, here's what you need to know. Here are the 5 things you need to know for the upcoming school year. And it's really centered around having your technology, your Wi-Fi, getting into the platforms that we use, which is how our teachers will connect with our kids. They will connect with them through Google Meet, through a platform called Schoology, and a platform called PowerSchool. So we're going to do a demonstration for parents to really understand how to use those things. We're asking our teachers to limit their use of platforms to just those 3 things, because we heard loudly and clear last spring. Parents said, you had me on this, you had me on Dojo, you had me on PowerSchool. It was too much.
Right.
And we understood it. And so we said, okay, we're going to really fine tune that. So that's a district-wide orientation that says this is what you can expect from the district educationally. And then, and Stacey can speak to this better than I can. And then each school team or each teacher, if they teach alone, will have to schedule a very specific orientation to families about their classroom and their classwork. So Stacey, you want to speak to that?
So what next week will look like district-wide for all Cincinnati public school families? We will host kind of well, for Evanston, Wednesday, we'll host what's called a meet and greet. So all of our families will have the opportunity to come out, meet the teaching teams while social distancing, receive their materials. So if you have not received your laptop, we're going to make sure you get it that day. Any materials that teachers want students to have, you'll have an opportunity to pick it up that day. Now remember, this is Wednesday, so you will get contact and communication with each teaching team. So for us, we're going to have a station set up for each teacher. So students and their parents will have an opportunity to come have a face-to-face, meet Mrs. Childs, meet Mrs. Taylor, meet all the people on staff. Our staff will be adorned in our Evanston school shirt, so you will know who the staff members are. They'll get all materials that the district got out. So you'll leave us. So Thursday for Evanston, we will have orientations all day. So what we're doing in an effort to make sure that we are making ourselves available to all of our families, we'll have orientations 9, 1, and 6 p.m. So essentially, if you have multiples, you can hit up primary, 2nd grade at 9, and then you may need to get on later because you've got to get back to work, and you can get on at 6 to get with the 5-16. And we're going to do a overflow that Friday at 9, just in case you missed, you couldn't make it. And then I'm going to do my convocation for my parents on that Friday also at 6 p.m. just to let them know, hey, we're here for you. If you need anything or we missed anything, please let us know, because our overall goal as a district is to make sure we support our families. So every school in the district will have something similar to this rolling out this week.
Okay, so, all right, so every school will have its own kind of orientation in addition to this district-wide orientation. And I love the fact that parents get to meet the teachers face-to-face and the principal and all that, because I think that helps a lot. And they get their materials and they can get their questions answered. They feel connected, and then that connection continues. I have to mention too that on COVID-19 communityresources.com, starting this week, there's a special tab for schools. So all this information will be on that special tab. A second thing I wanted to mention, because we talked about Jack and Jill and Delta Sigma Theta, AKA Links, and lots of top ladies, lots of other organizations, but COVID-19 communityresources.com has a hashtag Black Women Strong. So all these groups, there are about, I think 20 of them, have all joined together, and they're working with the Center for Closing the Health Gap as well. So that is a huge resource pool, and they want to support CPS. So we're really thankful to everybody out there supporting our children, whether they're at CPS or some other school system. This is so important. There was one more, oh, I'm sorry.
Can I say this too, Jan-Michele? Yes. For all the families out there, if you haven't had contact with your schoolhouse and you haven't heard about what's happening next week, please reach out to your individual school. Call up the office. Haven't heard anything. I'm hearing that this is occurring because these are universal. Everybody's having this. Something's happening this week for every student in every seat. But if we didn't reach out to you, please, Monday morning, call your school and they can give you more detail.
Yeah, it sounds like communication is like the main thing we're really going to have to emphasize. You know, it's really important for parents to talk to the teachers and the principal and to stay connected, stay informed. I hear Valda saying there's a lot of information. She's found a way of organizing that. So she might have to give us all some tips about, you know, how do you keep it organized when you have, you know, three children and all this info coming in. But it is important to read it and to see it and to make the meetings you can, right? So yeah, we've got to stay in touch. Okay, here was another question I didn't want to leave out. Levon Seiler had another question, and he said, how do we identify an exposure with kids? He said, are we monitoring via video? Okay, here's what he's saying. It seems like it's an impossible task for teachers and staff to monitor an exposure of less than 6 feet for over 15 minutes. And I want to say, I think it's self-reporting, but I don't know if there are any answers there.
I know as a district, we are asking all of our families in the event that your baby doesn't feel good, because I know I'm a mommy first. My husband and I have been in a situation where we're like, you okay? We're gonna give you this Tylenol. You good for 8 hours while I go to work. I'll grab you from daycare. We're asking people, my husband and I are like, let's not do that again.
Right.
We're asking families, don't do that again.
Right.
Keep your baby home. Think about your baby and everybody else's baby, and we are going to make them whole academically. We're not going to penalize a child because you just weren't sure. We're going to support 100%. So that will be huge, because often parents do say, I know I'm guilty, and families are just not sure. So we are actually doing health checks right at the door. So if your baby does come in and they have a slightly elevated fever, we have a plan to address that immediately.
Right, that's important. I'm laughing because I can think about, you know, my son. I'm like, you don't feel well? Are you sure you don't have a test today? Like, what is that about? You need to get to school. So yeah, we do have to pay attention when the children aren't feeling well. Keep them at home because we know this is serious. And so what do we want to, you know, I don't want people to start getting upset about November, but since it came up, you know, what are we looking at here as a plan? Or is it too early to really talk about that? Maybe it's too early.
Well, I'll just say from a district perspective, but obviously Dr. Jackson knows far more about the medical world. So I was on a call with the governor about 3 Saturdays ago, a small group of superintendents who were speaking with him. And what he said is that he has spoken with, earlier that morning, an expert that he consults with around national modeling as it relates to pandemics and infectious disease. And so his modeling expert said that November through January, it is unlikely that we will be able to be in face-to-face session. Okay. All right. And so that's why we are trying to really front load as much as we can in terms of practices. Here's what you do. I was also on a call with some physicians earlier this week, and it was interesting because this physician said she was looking at the data from across the nation and worldwide, and school districts who had gone back. And so she said, Laura, I think you need to do some simulations right now for a long time closure. And so we have Children's Hospital coming over on Tuesday to work with our team to do some simulations around, if this happens, go to page 5 and do this. If this happens, go to page 8 and do this. And so we're trying to make sure that no matter what happens, we'll be prepared. But we are very cautious about the fact that we may not be in session in November through January at least.
Okay. Well, you know what? It sounds like CPS is ready. So, you know, I feel confident whether we're in session in person or virtually, we are ready. We are ready. And so this is wonderful. I just want to throw out these phone numbers one more time before I turn things over to Renee. But if you're a CPS student and you don't have free Wi-Fi, please call 513-566-3895. In Spanish, 513-566-3894. And if you have moved or changed your number, you need to let CPS know, because communication is so essential during this time. Don't get out there by yourself. Stay connected. Call 363-0123. And all of this information will be on COVID-19 communityresources.com, powered by the Center for Closing the Health Gap. I want to thank all of you fantastic panelists for sharing your information with us. It's been very reassuring for me as a parent, and I'm just really grateful for all the work that all of you are doing. And let me turn over for closing remarks to the CEO, President and CEO of the Center for Closing the Health Gap, Renee Mahaffey-Harris.
Well, first of all, thank you, Jan-Michele, Kearney, Councilmember Kearney, for moderating today. And I want to thank Superintendent Mitchell for your leadership. And I think CPS is ready, and I think other districts need to follow the structure and work that you and your team have put forth. Principal Simmons, thank you. And Dr. Jackson, thank you for your continued work, not just with as a pediatrician for all of these years, but also with CMA and as well as your role with Anthem. And Valda, Freeman-Karmo, it's great to see you. I'm so glad to see all that you have been able to learn and thankfully share with other parents on how to navigate this time. I think you said something so important by saying that we all need to give each other grace. It's grace through all of this time. And when we think we've gotten it right, then we got to give more grace. And so I think that's what we all need to do for each other during this time. What I want to say to you, Superintendent Mitchell, is that you have a commitment from Center for Closing the Health Gap, our partners in COVID-19 communityresources.com, Eric Kearney, President and CEO of the African American Chamber of Commerce, Eddie Keon, President and CEO of the Urban League of Greater Cincinnati, Joe Mallory, the Vice President of the NAACP, and the Cincinnati Medical Association, Dr. Walker, and our Councilmember Jan-Michele Kearney. We are going to make sure that we get the communication out. We are going to work with your team to build the tab so that we can keep information updated there. We're going to work in our partnership with Radio 1 to get that number out so that students whose number and information have changed, that they can get the information they need for their babies and for their children in the school district. So we are all in this together. And again, I think we need to remember to give God's grace to each other. And I want to thank you all for your leadership and your work in our school district and in our community. And I ask each of you to continue to do what you're doing, but I ask for all those listening to remember to give each other the grace that God asked us to give so that we can get through this time together. So thank you all, and you all have a good weekend.
Yes, thanks everybody. Thank you.
Bye-bye.
Bye.
Bye-bye.